Early on in the pandemic, there's a lot of unknowns about how bad the pandemic would be.
We were seeing a new disease. It was definitely a little bit overwhelming.
Nobody really knew what was happening. It became very real very quickly.
It was quite new to see patients that were critically ill by themselves in a room. I had never seen anything like that.
Teachers come to school for the interaction with children and watching them learn. That was completely taken away. It was very scary. I was actually in the hospital with my mom. They lost patients. The strain was just unbearable. We had prayed every day, every night for that vaccine to come.
Life here on campus was quite a shell of itself. It was eerie and sad.
You'd walk around campus and it felt like you're one of the few people here. It felt a little like a ghost town. I really feel for many of the students who are trying to navigate their educational experiences, the faculty who are trying to keep doing the research that they do, the staff who in many cases felt like they were risking their own health to come back and make things possible.
The university started to shut down labs, except labs that were working on COVID. Our colleagues weren't around, it was just kind of us working in the lab. We'd been studying coronaviruses for years. We had a lot to do. People were working in the lab almost nonstop. We did the best we could to end the pandemic as soon as possible. The goal of a vaccine is to train our immune system to recognize the pathogen, recognize the invader. A lot of times as scientists, we fail. When I got into vaccine development and structure-based vaccine design, it was with the knowledge that likely we would never contribute to a vaccine.
When Jason started his coronavirus work, we had no idea there was a pandemic coming, and he had no idea that there was a pandemic coming.
When we first learned that this was a beta coronavirus and was similar to SARS, we knew we could just apply everything we had learned previously to what would be called SARS-CoV-2.
So we've all seen these white globes with red spikes. Those spikes are very important for the function of the virus. Using structure-based design, they will stabilize it before the infection and then is much more effective at preventing the infection. Based on their work that they started in 2013, they knew how to make a stabilized SARS-CoV-2 vaccine.
The big day was probably when we first heard the results from the phase 3, and we heard efficacies of 94 and 95%. It was just really exciting. It's very satisfying to be a part of something like the development of the COVID vaccines. You can often feel helpless and you aren't able to do things. I think there's a lot of people during the pandemic who wanted to contribute.
When vaccines first started being shipped to institutions, the feeling that I felt was hope.
Things got a lot less scary because of the vaccine.
Getting my vaccine was pretty exciting. I had people that were getting vaccinated at that time asking for selfies, which is kind of different.
It was just an amazing feeling.
We started thinking, maybe things are getting back to normal.
The first day back at class was just really exciting, just to have that buzz on campus.
I could just feel the joy in our faculty and our staff as we got to be back around those students again.
You're hoping that we would never need a vaccine for a global pandemic, and it was something that we were all really excited to contribute to.
The impact speaks for itself. Hundreds of thousands, if not millions of people who are alive today directly because of their research.
Jason's work has not only saved lives, but also saved our way of life.
Now people say hello to each other, socialize, we see each other.
Just having them back in the building and sitting in the room again, it just filled all of our hearts. Thank you for doing the work that you do.
Thank you for showing the world how important basic science can be.
Thank you from the bottom of all of our hearts.